Hello, friends. So I'm live on My Good Times today. I'm just waiting for more audience to come, and then I'll be starting my topic of the day. Hope everybody's fine in the time of this global crisis. Though it sounds very boring, but it's very important to follow all the precautions for this COVID 19. Yes, I can see the viewers are coming up. Okay, so I'll be starting now. Friends, this is Dr. Pankaj Chaturvedi, your dermatologist from MedLinks Group of Clinics, New Delhi. And I'll be talking about the skincare for brides to be. Now, this is a very difficult situation because of this global crisis, and I can understand the brides who are going to be married in a couple of months. It is a difficult time for them because um, all their schedule or their shopping, everything is running haywire. So, I'll be giving certain tips how to take care of your skin and how to get ready for your D Day. So, coming to the basic things, which are also the most important things to be followed. And these basic things should be followed as a routine, no matter what happens, but you should stick to this regime. Okay. So, your day should start with a good cleansing. Why cleansing is important? Because cleansing removes the debris and the dead cells from your skin. Now, choice of the cleanser depends on the type of the skin. Most of us, what we do, we just go to the cosmetic shop and just randomly pick the cleanser, whatever packing we like or whatever we are recommended by an influencer on the Instagram or social media. So this should not be done, right? You should know what type of cleanser should be used on the type of skin you have. So if you have dry and sensitive skin, use a gentle cleanser, a cleanser which does not make it further dry. Because when we cleanse, we also take a lot of oil out from the skin, and dead skin, the dry skin, it doesn't have very uniform continuity on the surface. So the loss of water and loss of oil is much more prominent in the dry skin. So use a gentle cleanser. If you have oily or combination skin, then a normal cleanser is useful for you. If you have got acne prone skin, then there are specialized cleansers which have got AHAs, alpha hydroxy acids in them, beta hydroxy acids like salicylic acid, AHAs like glycolic acid. So they also have got anti-acne properties, and they are more efficient in taking the oil out of your hyperactive oil glands, right? So they will also give you a good balance in the hydration and the oil. After the cleansing, and cleansing has to be done twice a day, morning and night. In the daytime, suppose you go to any kind of event or you apply some kind of makeup or foundation, then it's important to cleanse your skin after that. You can use a gentle cleanser, you can use micellar water to clean it. After the cleansing, use a toner. Choice of the toner is important. So, if your skin is dry and sensitive, avoid using alcohol based cleansers. Right? Use a gentle cleanser. There are a lot of hydrating toners are there. So, you should use a hydrating toner rather than using an alcoholic toner. After the toner, your day creams. Day cream is an umbrella term. That means whatever you apply after cleansing and toning is your day cream. So, day cream can be a moisturizer, day cream can be a nutrition based um, serum or a cream so that it gives nourishment, hydration, and makes a barrier, makes a layer on the surface of your skin so that whatever nutrients are going inside, they're sealed. The hydration is sealed, right? So that your skin doesn't get dry. So, for the dry skin, my recommendation is you should go for day creams which contain vitamin E or hyaluronic acid. If you have got extremely dry skin, look for a molecule called as ceramides. So ceramides are repairing agents which repair the damaged skin because of excessive dryness. So dry skin, look for vitamin E, hyaluronic acid, and ceramides. And that moisturizing cream will serve as your day cream. If you have got oily skin, then there are certain creams which uh, control the oil production, right? So look for those kind of creams, like azelaic acid is there, and salicylic acid based creams are there, mandelic acid based creams are there. So these creams, they reduce the oil secretion and they calm down your sebaceous gland so that the tendency of acne can be taken care of. If you have got combination skin, again, you can choose either of them depending on the basic type of your skin, right? So a lot of people who have combination skin, they feel that it's combination but more towards dry side, and there are a lot of people who have combination skin which is more towards oily side. So there's a range of the combination skin. People having oily skin or combination skin can also use vitamin C serums as the day creams. It's a very good agent. It has got antioxidant and skin lightening properties, and one of my favorite ingredients to be used in the daytime. So once you're done with your day cream, then top up this with a good SPF. Now there's a common misbelief. Everybody says that, why to use a sunscreen when we are staying indoors. My take on this is a little different. See, indoor exposure of ultraviolet rays is substantial. We cannot ignore it because these days we have got LEDs, we have got CFLs in the house, so they also emit ultraviolet rays. Also, during this lockdown period, a lot of people, they stand in their balcony or they spend some time at the rooftop, so they are potentially exposed to the ultraviolet rays. So, application of SPF 30 is essential. Make it a routine. Why? Because any good habit which we follow, that comes in our reflexes. So if you'll use sunscreen on regular basis, chances are very less that you will forget application of the sunscreen in the later phase of time. So make it a routine to apply sunscreen. There's one more important thing which newer studies are telling us. There is a new type of light called as blue light. Now, blue light is emitted by the screens, your laptops, your TV screens, your mobile phones, your iPads. Blue light causes a lot of damage to the skin. And we often ignore this because we are not aware, because we think we're not sun exposed. But even this blue light is quite harmful to the skin. Recent studies have shown that people who have got pigmentary disorders like freckles or melasma are quite sensitive for this blue light, and this blue light increases the intensity of the hyperpigmentation and also precipitates the premature aging in the form of lines and wrinkles. So protection of blue light is very important. Unfortunately, the common sunscreens, they do not give you adequate protection from the blue light. For this, look for two molecules in your sunscreen. One is iron oxide and second is lutein. Now, any sunscreen which has got iron oxide looks little tinted, right? So um, tinted sunscreens are my preferred sunscreens because they give you additional layer of protection in the form of blue light protection. And the lutein is an antioxidant, so these sunscreens, they give you a very good protection from visible light, which is blue light. And of course, in the lockdown, everybody's sticking to Netflix and Instagram, and the screen time is very high. So you can also go for good quality screen guards. Of course, you cannot go out as of now because of lockdown, but in future, look for a good screen guard which filters these blue light from your screens. Coming to the night regime. Night regime is very important. Why? Because this is the time when you apply something, it stays on the top of your skin, right? Overnight, uninterrupted. So this is the best time to repair your skin, to deliver the active ingredients, the nutrients, and active molecules. Choice of the night cream is also very, very important, right? You cannot randomly pick a night cream. Okay, I have seen advertisement and this good influencer was talking about this night cream on Instagram and I should use this. No, don't make your skin a laboratory. right? Experiments, because you're a bride to be, you don't have time to experiment, right? So consult a good dermatologist, get your skin analyzed properly, and get your regime made so that you do not end up getting bad rashes and acne because of wrong creams which you use. I'll give you a few general tips on how to choose a night cream. So again, it depends on the skin type and the concern. If you have sensitive and dry skin, you have to be very, very cautious. Why? Because most of the night creams, they have ingredients which are like retinol, AHAs, BHAs, and these are not designed for the skin type which you have. Dry skin is thirsty for hydration and moisture. So, whenever we are picking a night cream for dry skin type, we should look for hydrating agents like hyaluronic acid, ceramides, vitamin E, and other deep moisturizers, right? So go for a night cream which is rich in texture and gives you deep hydration. Okay, so this should be the regime for the dry and sensitive skin. Try to avoid anything which has got intense fragrance, because fragrances, they also react with the dry skin type and sensitive skin type. If you have got combination skin, or if you have got dry skin, combination and oily skin or acne prone skin, then there are a couple of molecules which will be very, very beneficial for you. One is retinol. Retinol is derivative of vitamin A, and it is known to increase the cellular turnover, and it also pushes a cell to divide and uh, basically regenerate, right? So it increases the regeneration of the cells, and this is the reason why we call retinol as a magic molecule when it comes to anti-aging, right? So one of the preferred molecule is retinol. Now, retinol, the quality of the retinol matters, right? Retinol should be from a good company. It should be um, non-irritating retinol. Now, what happens when we apply retinol creams? If the creams do not have good vehicles to push and carry it inside the skin, what happens? The residue which stays on the top of the skin might give you reactions and rashes, right? So a lot of people, they the moment they start using retinol, they complain that my skin has got sensitive, my skin is exfoliating, my skin is red, and it's burning. Okay, so two things has to be taken care of. One, start with less quantity. Number two, should be a good brand. Number three, don't massage it, right? So sometimes people become over enthusiastic and they massage it like a facial cream. So don't do that. Retinol is a very active molecule, small quantity, and then gradually increase the quantity, and you can go up to one fingertip unit. So retinol. Second molecule, so what retinol does, gives you skin brightening effect, reduces the fine lines and wrinkles, and also reduces the chances of acne and hyperpigmentation. So very good molecule. The only drawback is it cannot be used on dry and sensitive skin because it causes microexfoliation, increases the cellular turnover. So people who have got dry skin, they complain that my skin has got even more dry, right? Then AHAs, alpha hydroxy acids. You must have heard about glycolic acid and lactic acid. So what happens? These AHAs and BHAs, they also cause microexfoliation. So microexfoliation leads to removal of the top layers of the skin where the hyperpigmentation is there. So if you've got pigmentary problems, you have got acne issues, post-acne pigmentation, these AHA and BHA based creams, especially AHA based creams, glycolic acid based serums or creams, they'll be quite useful for you, right? So this should be your regular regime. But now I'll talk about something which most of the people forget. Now, your skincare doesn't end just by applying your cleanser, toner, moisturizer, day cream, and night cream and sunscreen. No, you have to take care of the specialized areas as well. Now, when we talk about specialized areas, that means your under eye creams, right? This is the first point of contact. When we look at somebody's face, we look at the eyes. So, if eyes are looking tired or hyperpigmented, the face looks dull. So do not forget to use a good under eye cream in the daytime as well as the night time. Again, there are a variety of creams. There are under eye creams which are more focused for hyperpigmentation, and then there are few creams which are more focused for uh, puffiness, right? Then coming to your hands and feet. Now, one of the biggest problem which we are noticing these days, excessive dryness in the hands. Reason, how many times you guys are washing your hands these days? Probably more than 10 or 15 times. So, overuse of sanitizers, excessive washing of your hands and feet leads to dryness. Why? Because whenever you wash your hands, the moisture goes off, right? Your skin becomes more and more dry. So, we are seeing a lot of hand dermatitis. In fact, a couple of my friends and me, we are writing a research paper on the cutaneous manifestations of excessive hand sanitizer, right? So we are seeing a lot of people with dryness and itchy hands, and especially the web spaces, they are turning red. So we don't want you to look 20 years older when we look at your hands on the day of your marriage, right? So how to take care of hands? Whenever you wash your hands, apply a hand cream. The moment, so doesn't matter how many times you're washing your hands, because safety is important, but every time you wash your hands, you have to apply this hand cream or good moisturizer. So this is also very important. Then comes to body. So after taking shower, use a good body lotion so that you can repair the body skin as well. And a couple of things you can do at your home 2 days in a week, right? So one is you can apply a sheet mask to give hydration to your skin. So if you have got dry skin, you can use a sheet mask. Then there are few exfoliation based masks and face packs available, and home based peeling systems are also there. So if you have got oil and dry skin, you can use these home based peels as well. There, a lot of people ask, doctor, how many times I should scrub my face, right? So scrubbing, I'm not a big fan of scrubbing because it's a very crude way of exfoliating your skin. But again, because of this lockdown, not everybody has got access to a dermatologist. Nobody, like these days, you cannot go and get a chemical peel or microdermabrasion or medifacials in a dermatologist clinic. So you can use scrub 2 to 3 times in a week, not more than that. Over exfoliation because of the scrubbing leads to sensitive skin, which is more prone for hyperpigmentation and photoaging. So this should be your regular regime. Now, I'm also getting a lot of questions, and once I'll finish my talk, I'll ensure that I answer all the queries. Now, a lot of brides, they ask, doctor, how to prepare ourselves, because this is a very important event in somebody's life. So it depends how much time you have. You have got 3 months, you have got 6 months, you have got 1 month. Ideal situation is if you have got 6 months, it's a perfect time to enroll yourself into a bridal program in a dermatologist's clinic, and so that your problems can be tackled individually, right? Now, what is normally done in these kind of pre-bridal treatments? So when we talk about pre-bridal treatments, we focus on different aspects of your skincare and overall aesthetics. In this comes your glow. We address any concern which you have, like your acne scars, pits, hyperpigmentation, fine lines, wrinkles. And a lot of people, they do not have very well defined jawline, so we can also work on the skin tightening. A lot of brides, they are a little overweight and they say, doctor, I want to look a little slimmer on my wedding day. So we can also go for body contouring, surgical as well as non-surgical. Both the ways are there, and very efficient. And in a short period, we can actually make a person leaner. Then laser hair reduction, unwanted hair. Doesn't matter how good skin you have, but if you have got coarse facial hair, the face looks very masculine. It looks little dark, right? Then underarms, bikini area, right? So these are the areas which can be taken care of by the laser hair reduction. So when a bride walks in our office and asks for about a bridal skincare package, we start with complete skin analysis. We write a regime for the person, like this is what you should use this kind of face wash, this kind of cleanser, this kind of moisturizer. Then we look for the concerns. If acne are there, we start the person on certain topical and oral treatments. There are certain therapies like chemical peels, carbon facial, so that in 2 months of time we can zap all the acne, and at the 1 month we can zap the acne spots. If somebody is having acne scars, we can offer collagen stimulation therapies like microneedling, microneedling RF, fractional CO2 lasers, collagen stimulation therapies to make the skin smoother. Now, these things cannot be done overnight, right? So, why I'm explaining this? Because timing is very important. Now, somebody who walks in my clinic just a month before the wedding and says, okay, doctor, I want to erase my pits and scars, difficult because this process takes around 4 to 6 months of time. Same goes to laser hair reduction. Now, females, I haven't seen any female who says, "Doctor, I love my hair. I love to be hairy. I love my the facial hair which are then on my upper lips." So females have been designed in a way so they should be non-hairy. But of course, a lot of females, because of genetic reasons, because of certain hormonal issues, they are hairy. They have unwanted hair in the body. So we can use laser hair reduction, which is a very safe and effective way to remove the unwanted hair. We require around 6 sessions, and these sessions are done on a monthly basis. So if you start 5 months before your wedding, your 80 to 90% hair, coarse hair, will be gone by the time your wedding date is there. So laser hair reduction. Then comes the most sought after treatments by the brides, medifacials. Now, medifacials are therapies which are scientifically designed to give you a good glow, unbeatable glow with safety. Now, what is the difference between the medifacials and the normal facials? Normal facials are based out of chemicals and bleaches. So, when we go to a parlor and opt for a facial, you do not know what exactly is the composition of the face pack or cream which is being used on the face. And if you ask the person who's doing it, he doesn't know what he's applying on your face. So the facials, they're mostly based out of bleaches. So that instant glow which you see on your face is mostly because of the bleaching effect. Now what happens because of this bleaching? Skin is damaged. It looks fairer for a few days, but there is a lot of damage. And in the long run, your aging process also goes much more faster. So there is no, in fact, there is zero benefit, and there are a lot of harmful effects in the long run if you go for these facials on regular basis. And this was the reason why medifacials were designed a couple of years back. Now, these medifacials have a scientific background. There is exfoliation, which is very controlled in nature and without damaging the deeper layers of the skin, which is mostly chemo exfoliation by using certain alpha hydroxy acids or by microdermabrasion, which is like using fine crystals. Then infusion of uh, deep moisturizers like hyaluronic acid, ceramides. Then vitamins are infused. Okay, and these vitamins give you good brightening effect. So medifacials are the ideal treatments for anybody, any bride who is going to get married after 2 weeks, after 1 week, after 1 month, 2 months, 3 months. So we plan medifacials in a way so that we can take care of each and every aspect of the skincare, be it hydration, be it skin lightening. So depending on the concern, there are different medifacials. I'll name a couple of medifacials which are very popular across the world. Hydrofacial is very popular. Hydrofacial has been endorsed by a lot of Hollywood celebrities. Hydrofacial is very gentle. People who have got sensitive skin, this is ideal medifacial for them. So exfoliation and hydration at the same point of time. And in the meantime, there are a lot of antioxidants, vitamins, which go in the deep layer and nourish your skin. So hydrofacial doesn't make your skin sensitive and gives you a very good glow for your tea day. Then Insta Bright. Insta Bright is one of the very famous medifacials in our clinic. As the name suggests, Insta Bright. So Insta Bright uses a laser system to dilute the hyperpigmentation. So people who have got little dark skin or patchy skin, people who have got acne spots, or somebody who has got facial hair which are not thick enough to be treated by laser, Insta Bright is the facial of choice, right? So it makes your skin brighter immediately and also bleaches your hair because of that laser. So Insta Bright is famous. Then Oxygenio. Oxygenio is is a very famous medifacial from Israel. So it causes exfoliation, hydration, nutrition, and skin tightening at the same point of time. Dermafrag. Dermafrag is a very good patented microchanneling system. So they have got patented serums. These are hyaluronic acid, vitamin C, vitamin A. So depending on the type of the skin, that different serums are there. And this cocktail is infused in the skin using a very specialized microchanneling system. Then Dermapen 4 is there. So Dermapen 4 is a very versatile tool and a very nice delivery system. We can infuse hyaluronic acid, retinol, antioxidants in the deep layer of the skin without much of downtime. And if somebody has got acne scars or any complication because of any kind of past trauma, so even that can be corrected by using Dermapen 4 because it also stimulates collagen. So there are different medifacials which can be done on the face to improve the quality of the skin. A week or a few days before the wedding, we also recommend we can do certain therapies for the body as well, right? The body polishing. Body polishing is done by microdermabrasion. We use a specialized diamond microdermabrasion tip so that we can remove the dead layer of the skin. And then after that, a couple of moisturizers and packs are applied to give you a brightening effect. Because on the day of the wedding, it's not only your face is visible, like people watch how you're walking, how your feet are looking, how your hands are looking, because you're the center of attraction that day. So you should not ignore these exposed body parts. Other than that, people who have got special concerns, like if somebody wants to just take care of some part of the body which is out of proportion or something which is a little chubby, like if you're a little overweight, if you look a little chubby, if you think that you need some inch loss, then there are certain amazing therapies which can be done to make you slimmer. One of the most popular is Cryo Lipolysis or cool sculpting. So this technology freezes your fat and is a non-surgical treatment, freezes your fat, and that treated part reduces in inches over 2 to 3 months of time. It's a slow process, but very, very effective. So if your love handles are bothering you, if your tummy is bothering you, if your thighs are bothering you, if your bra fat is bothering you, if your double chin is bothering you, we can use cryolipolysis. We can also use injection lipolysis. So we can target certain body parts, and suppose if you've got double chin and you want to get rid of the double chin, so double chin can be targeted by injection lipolysis, and by using certain medicines we inject locally, we can dissolve this fat to make your face look leaner and lifted. Then sometimes people have good amount of fat and they want to get rid of this fat immediately, so we can offer liposuction, right? So liposuction is a way in which we treat certain body parts surgically. So we make small ports, and through that port we insert a cannula, we break the fat and we suck it out, right? So in the real time we can take 2 to 6 liters of your fat, and that gives you very quick results. Of course, the surgery, but it's quite a safe procedure. So these are the things which we can plan well in advance. Also, these days, people want to look attractive. So, and every face is beautiful. I consider whenever I see my patients, I say you're beautiful because uh, God has made everybody, and God has designed us in a way. Everybody has got certain good, unique features, right? So everybody is beautiful, but sometimes people want to enhance their features, right? So I get a lot of brides who say, Doctor, I want my lips to look a little more plump because when I smile, my upper lip is not visible. I look a little sad. So we can correct your smile, we can correct your lips by using fillers. Very safe procedures, and If injected by a certified dermatologist, they give amazingly good results, right? So they're harmless, they're non-addictive. It's not like if you have got fillers done once, then you'll become addicted. That's not the case. Of course, I recommend brides not to experiment the fillers just 2 or 3 days before the wedding. At least give 7 to 10 days of time so that the swelling or any kind of bruise which happens in the procedure can settle. I'll tell you what all can be done, right? So we can make you slimmer, we can make your skin brighter, right? I don't use word fairness because I don't believe fair is beautiful. Every color is beautiful, right? What means, what matters? The glow and the brightness of the face, right? So we can make your face brighter. Then we can make your body slimmer. We can make your body less hairy. We can make your face slimmer. Now, how the face slimming is done? One, treat the double chin by using either the injection lipolysis or cryo lipolysis. Then there is one more thing which is called as Botox for the masseter, right? So, a lot of people, they have a broad face. This broadness is because of a muscle here called as masseter. So masseter muscle is there in everybody, but few people who chew a lot or sometimes people grind their teeth while sleeping. This muscle becomes little bulky, and because of this, the face looks little broad, like a squarish face. So this is a masculine feature, and it doesn't suit to a would-be bride. So by using Botox on these muscles, we can make your face leaner from this area. We can also treat your wrinkles. We can also correct your under eye hollowness, right? So if you feel that you look tired, uh, if every time, like whenever you meet somebody and people ask a question, are you sleeping, are you not sleeping these days, you look tired, then we can use under eye fillers to correct your under eye hollowness. If you think your face looks too rounded and it's like a too chubby, we can also correct the proportions of the face by using fillers. So uh, we can recreate your jawline and the chin by using fillers. So we this is one of MedLinks is very famous for these procedures, and we get patients from India and abroad to get a chiseled jawline and a nice makeover of the face. Now, these treatments, common concerns are there. A lot of people say, Doctor, these procedures are going to make me look a little plastic or face. I do not agree. The way we treat, or the way a certified dermatologist who knows how to inject treats, face cannot look plastic because changes are subtle in nature. There are no drastic changes. Right? So we maintain the normal look of the face. We just tweak your features, we just enhance your features so that the same face looks beautiful. In fact, sometimes it is very hard to tell what procedure has been done on the face, right? So, this is a myth. Neither these treatments make you plastic, nor these treatments make you addicted, right? So, if you stop these treatments, there's no side effect, there is no harm which is going to happen. This is the commonest myth. So, this is my message to all the would be brides that please follow a good regime, right? Don't experiment. Don't try a new DIY looking at your Google or your social media. Stick to a good regime. You need not to use 10 types of different products. Just follow these basic steps: a good cleanser, a good toner, moisturizer, good day cream, night cream, and sunscreen, and you will get a fantastic skin. And the moment lockdown is over, visit your dermatologist and tell him to make a plan for you. And I believe you are going to look awesome on that day. Now I'll be coming to the questions by the audience, getting a lot of questions. So, yes. Doc, your skin is shining, definitely going to follow your tips. Yes, I believe if a dermatologist is not having good skin, it's very difficult for him to impress his patients, right? So, because I'll be uploading my few of my videos on my Instagram. I'll be showing that what all treatments I take for myself, right? So I believe on my treatments. I never recommend anything to my patients which I do not trust upon, right? So whatever I'm recommending to my patients, I have experience. I either have experience of that treatment, or I know about that treatment. I know that it's not to harm you and it's completely safe. Any treatment for ringworm? I'm suffering from this problem since last 4 months. Diksha Singh. See, ringworm is a fungal infection and it's very difficult to give you a telephonic advice without examining your skin. And yeah, so this is a message to the audience. Do not self-medicate yourself. Do not go for the shortcuts. Now, ringworm is a problem which has to be treated by topical and oral antifungal agents, and that has to be given for proper duration. If you take these treatments for a short period, it might come back. It might come back in a more severe way. Okay, so do not do that. Please help with cure for under eye bags, Miss Shirley Chaturvedi. So under eye bags, uh, there are two major issues with the under eye bags. One, there are true under eye bags. What happens in the true under eye bags? The fat which is surrounding the eyeball that herniates or bulges through the lower eyelid, right? So in this case, there are well-defined eye bags which are mostly seen in people who are 40 plus. There is surgical intervention. The treatment is called as blepharoplasty surgery, where we put a small incision here and take the fat out. It's a small 1 hour surgery done under local anesthesia, very safe. But people who are young and feel that they have baggy eyes, most of them are having a problem called as tear trough. Tear trough is a condition where there is loss of volume from the under eye area. Now, because of this loss of volume, the lower lid looks little bulgy, right? Why it is looking bulging? Bulgy because beneath the lower lid there is loss of volume. So the ideal treatment for this is uh, under eye fillers. The moment this volume loss is corrected by using a filler, you'll see instant changes, right? You can visit my Instagram page and you can see some good results of under eye bags without any surgery. So we have surgical options and we have non-surgical options as well. For your information, I'll just tell you. So our Instagram and Facebook handles are MedLinks Aesthetics, right? MEDLINKS Aesthetics, AESTHETICS. So you can follow our Facebook and Instagram, and you can see some nice transformations and good results. Then Prabjot, I use almond oil. My skin is normal, no facials, nothing. Is it fine to reduce wrinkles? See, almond oil is good for the skin, but it depends what type of skin you have. I'm not a big fan of using these oils. And like I only recommend these kind of oils in people who have got super sensitive and dry skin. So if you've got dry skin, almond oil is good for your skin. But if it is normal or oily, it is going to give you problems, right? So better not to use if your skin is oily or combination skin. So I think I have answered all the questions, and now I'll be ending this video. If you have any other question, if you have any other query, you can leave your questions on our Instagram or Facebook, and we'll be very happy to answer all your concerns. Take care of yourself and have a good day. Thank you.